Please be clear on that with coaches. Like, don't make them be like, do I have anxiety? Do I have OCD? Do I have depression? Like, they are not equipped for that. And we shouldn't put that pressure on them. That's a lot of training that we have to go through as therapists for that. Okay. Hello and welcome to the Mommy Consultant. This is a space that empowers superhero working moms to put their wellness needs first so they can pass down a generation of wellness. I am Michelle Kay and I am your Mommy Consultant. So today we're actually going to talk about how Chat GPT is kind of giving us some answers, and do I agree with it as a therapist and a coach or not? So I am a therapist. I'm a licensed marriage and family therapist, and I'm also a mommy wellness coach. So I love talking about therapy, love talking about, coaching, love talking about empowerment for moms. And so how we can really work on to pass down our generation of wellness. I have been using Chat GPT just to kind of see what it says, and do I really agree with Chat GPT or not? So what we're going to do is we're going to dive in and see our results from our question that we're going to ask to ChatGPT about therapy and coaching. Before we go into that, I want you to click subscribe to the Mommy Consultant. All right, so let's dive in and let's see the results. So my question was, what are the 5 differences between a therapist and a coach? I was trying to think of like 5 or 10, like where should we go with that? But I thought 5 would be a good number to start off with. So please comment below if you feel like you agree with some of these things or not, especially if you've had a therapist and or if you've had a coach. And so really talk about maybe even the differences that you have experienced, for yourself. Okay, so let's see what ChatGPT says. Therapists and coaches serve different roles and have distinct approaches to helping individuals improve their mental and emotional well-being, as well as achieve their personal or professional goals. Here are the 5 key differences between a therapist and a coach. ChatGPT just lays it all out there. I could have said it, like any better. It's great. Okay. So this is interesting. I have not looked at these. So focus on the past versus focus on the present and future. Ooh, I love this one. Okay. Therapists primarily focus on addressing healing past emotional or psychological, I was going to say physiological, psychological issues such as trauma, anxiety, depression, or unresolved conflicts. They often explore how past experiences influence the present. Coaches, on the other hand, primarily focus on the present and future. They work with clients to set and achieve specific goals, develop new skills, and overcome obstacles to personal or professional successes. Ooh, what do you think about that? Put it in the chat. So I would agree with this one. I would agree. Sometimes there becomes a blend of both. So that's the hard part. But I do agree our training as a therapist is a primarily focused, and goes into different theories, but like psychodynamic or psychoanalysis. So we're looking at Freud and really looking at past issues and how your trauma from your past has stemmed from what you're experiencing present day. And we're really trained in that. We get a lot of training to handle the trauma, handle a lot of the situations that we have experienced in our past. So I am trained. I do a lot, have done a lot of training in trauma. I am trained in EMDR, which is eye movement desensitization reprocessing, which is a great kind of strategy tool, technique to really address trauma. And of course, we look at trauma, there's different levels of trauma and what you experience. And so I'm being trained in that, like only therapists can be trained in that. So I think it definitely is important. And we do work primarily with diagnosis. So a mental health diagnosis versus like a coach doesn't really work with a mental health diagnosis. I mean, it would be great if they're trained in those things, or at least they have knowledge of trauma or knowledge of mental health diagnosis, because it is needed. But we are focusing, because I do coaching for moms and particularly for working moms, and it's about present focus. What are you balancing? How are you balancing your work and your home life? And some really specific skills that can be used for that to overcome those obstacles. So I definitely get that. Number 2, clinical training and licensure. So therapists, such as clinical psychologists, counselors, and social workers, typically have clinical training and licensure in mental health disciplines, is what I was talking about before. We're required to diagnose and treat mental health disorders. So that is very important to understand that our training aligns with treating and diagnosing mental health disorders. And it's important that we really focus on that. Coaches come from a variety of backgrounds and are not necessarily required to have clinical training or licensure. So true. The coaching world does not have any requirements in terms of certification, in terms of like clinical training or licensure. Coaches have expertise in specific areas. So it's like a business coach, you're going to get a business coach. And then they may hold certifications related to coaching. So yeah, I think that's really important. It doesn't necessarily mean that they have to have a certification. That comes up a lot. People are like, oh, should I get a certified coach? And I'm like, I think you just go who you're comfortable with. And if you feel like they can deliver what you are trying to work through, that's most important. Okay, so I do agree with that. Okay, Chat GPT. Put in the chat if you agree, if you can comment about that. Scope of issues. Therapists are equipped to address a wide range of mental health issues, including diagnosable disorders, and they often work with individuals experiencing emotional distress. I'm going to change that and say it's not only individuals, but like families, couples. So my field, like we work a lot with like family, couples, and the family system too as well. Coaches are more focused on personal and professional development and do not diagnose or treat mental health disorders. They work with clients on issues like career development, leadership skills, and life transitions. Yes, yes. Ooh, I like that one. Yeah, so usually coaching, there's a lot of work in how are you navigating this life transition. Doesn't mean that the therapist wouldn't, but like that's kind of the primary focus. I'm not talking right today. Their primary focus when it comes to coaching, like that life transition, what they're dealing with. Like I know some people do coaching for like mindset coaching for athletes. Like that's a whole life transition that I think is difficult. And, having a coach who has experience in that is helpful. So I get it. Okay. And really, they're not diagnosing mental health disorders. So please be clear on that with coaches. Like, don't make them be like, do I have anxiety? Do I have OCD? Do I have depression? Like, they are not equipped for that. And we shouldn't put that pressure on them. That's a lot of training that we have to go through as therapists for that. Okay. Also, it's just not appropriate. Like, not appropriate. There's a lot of assessments and things that need to be done in order to have a true diagnosis. So, okay, structures and goals. Therapy often follows a structured and clinical oriented approach with treatment plans, goals, and progress assessments. The therapeutic relationship may be long-term. Coaching tends to be more goal-oriented and action-focused. Coaches work with clients to define specific objectives and develop strategies to achieve them. The coaching relationship may be a shorter term and more flexible. Yes. So I hope people understand this. Like therapy is definitely a long-term relationship. I mean, sometimes I think we do keep our clients for too long, and not let them or sometimes it's good to have a break and then come back. But that's really, we're doing a clinical approach. We're doing treatment plans. We're creating goals. That's so important. Coaching is definitely a little bit more short term. I think I've had 4 or 5 coaches I've had like coaching on like media kind of things. I've had coaching on like marketing, coaching on business, spiritual coaching. I've even done some of that, like dabbled in that. So I think that it is definitely more short term. And so just being clear on that, like usually you're going to be with a coach for a specific amount of time. And then like, bird, you're flying away. Like you may not have a coach for like a long time. Okay. So that's a big difference. I agree with that. I agree, Chat GPT. Okay. Number 5, privacy and confidentiality. Therapists are bound by strict ethical and legal guidelines regarding client confidentiality. The information shared in therapy sessions is highly protected. So there's a lot of systems we go through to protect our clients' confidentiality. Coaches also value client confidentiality, but it's not the same like legal and ethical standards as therapists. I definitely agree with that. The level of privacy and confidentiality can vary depending on the coach's training and practices. So I would just even ask that question, like with your coach, like what does that look like? Sometimes it's in the document that you might sign with that coach. So just be clear on that. But yes, therapists, we're usually talking about confidentiality. We're legally bound for a lot of those things. Okay. So it's important to choose the right professional based on your specific needs. If you're dealing with specific mental health issues, therapy with a licensed therapist is often the appropriate choice. If you're looking to set and proceed and achieve personal and professional goals, coaching may be more suitable option. In some cases, individuals may benefit from a combination of therapy and coaching. I definitely agree with this one. To address specific needs in their well-being and development. So I agree with that one. I mean, I see great progress when I have a client who is doing therapy and then doing like coaching too as well, because they're delving into all those past issues. And then like they're getting these like actionable steps that's going to help them in their personal professional goals. It's just I've seen a life changing, and that's happened with me. So I've done therapy as well, and then also having a coach too. Just so amazing. Okay. So ChatGPT did pretty well. Answered the question. I would agree with this. Okay. All right. Well, thanks for joining us at the Mommy Consultant on our discussion on what's the difference between a therapist and a coach using ChatGPT. All right. Thanks so much. Subscribe to the Mommy Consultant.